Hello, I'm Sulaiman Mohammed. Ashiq, may I know your name?
Hello doctor, I'm Ashiq.
I have been asked to examine your eye. May I proceed?
Yes doctor.
Before starting, let's sanitize our hand. I am going to test the visual acuity. For this, I am using the smell and sight chart. Are you using any power glasses or reading glasses?
No doctor.
Make sure the patient is 20 feet away from the smell and sight chart. Please hold this card.
Okay doctor.
And close one of your eye. Now read the smallest line possible.
F-E-L-O-F-E-D.
Please shift your eye.
Okay doctor.
Now please read.
F-E-L-O-P-Z-D.
Okay. Now I am going to test the visual field by using the static finger wiggle test.
Okay doctor.
Now look into my eyes without nodding your head.
Okay doctor.
Now let me know when you can see my finger movement.
Yes doctor. Yes doctor. Yes doctor. Yes doctor.
Please close your eye with one of your hand. Now let me know.
Yes doctor. Yes doctor. Yes doctor. Yes doctor.
Now the other eye.
Yes doctor. Yes doctor. Yes doctor. Yes doctor.
Okay. Now I am going to inspect the eyebrows. The eyebrows look intact and there is no scaliness. Inspection of eyelids. There is no edema or lesions found. The color of the eyelids are normal. Now I am going to inspect the lacrimal apparatus and lacrimal gland and the lacrimal sac. There is no swelling found and there is no excessive tearness or dryness of the eyes. Now I am going to inspect the sclera and conjunctiva. Please look up. Look down. Look right. Look left. There is no nodules and swelling found. Now I am going to examine the cornea and iris for opacities. And I am inspecting the size, shape and symmetry of a pupil. Now I am going to examine the direct and consequential light reaction of the eyes. Now look at the pin. Now look at any direction away from the pin. Now I am going to examine the extraocular movement. Just follow the pin without moving your head. Now I am going to examine the lid lag. Just follow the pin. Now I am going to examine the convergence of eye. Please follow the pin. So now we are going to do the ophthalmoscopic examination. Make sure the room is dark. I set the ophthalmoscope to 0 diopter. Now I locate the red reflex and look for any opacities that enter the red reflex. Looking for the optic disc and retinal vessel and looking for the color of optic disc. And finally examining the fovea and surrounding macula. Okay Ashok, everything is normal with your eyes. Thanks for your cooperation.
Thank you doctor.
Hello.
Hello.
My name is Shubham. I am MD second year student and I have been asked to perform ear, nose and sinus examination. So can I get into the procedure please?
Yeah, you will.
So what's your name?
Aditya,
Age?
21.
So Aditya, let's center of hands first. So I will perform the ear examination first.
Okay.
So Aditya, do you have any problem in hearing?
No.
And any pain, tenderness surrounding the ear?
No.
Okay. So I will inspect the outer ear first for any deformity, lumps and skin lesion and any scar. The helix, antihelix, crus, concha, lobule and tragus. And now I will check for the otitis externa. I will move the auricle upward and downward. So Aditya, do you have any pain tenderness?
No.
And I will press the tragus also for otitis externa. Do you have any pain?
No.
And for the mastoiditis, I will press the mastoid one, the bony prominence behind the ear. Aditya, do you have any pain tenderness?
No.
Okay. So now I will look into the ear canal with the use of otoscope. So Aditya, can you tilt your head to the opposite side, please, slightly? Now I will pull the auricle upward, backward, and outward. And look for the cerumen, discharge, swelling, redness, and foreign body. And the bony impression over the tympanic membrane, and check for and look for short process of malleus, handle of malleus, and cone of light. So any contour to the tympanic membrane suggests the infection of middle ear and blockage of eustachian tube. So for the auditory acuity, I will perform the whisper voice test. So I will close the opposite ear. Aditya, I will whisper some words and you have to repeat it.
Okay. AC29.
So better. Now to the opposite ear.
BZ17.
Good. For conduction part, proceed to the Weber test. Aditya, I will put this tuning fork over your head and say yes if you hear the sound equally in both the ears. Okay?
Okay. Yes.
Okay. Now I will perform the Rani test. So for the Rani test, I will hit the tuning fork and place it over the mastoid process. Tell me yes if you stop hearing it.
Now.
So can you still hear it?
Yeah.
So the air conduction is more than bone conduction. So it is normal. For the vertigo, I will perform the fistula test. I will press the tragus and look for the nystagmus in the eye. So there is no nystagmus. So the test is negative. So now we proceed to the nose examination. First, inspect the nose for symmetry and deformity. The anterior and inferior surface of the nose, the L of the nose, the symmetry. For the tenderness, do you have any pain?
No.
And tenderness over here?
No.
For obstruction, breathe in please. Without. To the opposite nostril. Breathe in. Out. First cut. Now I will look into the internal structure of the nose with the help of pen light. For the nasal septum, I will flash the light toward the medial side of the septum. The nasal septum is intact, pink in color and straight. There is no perforation and no deviation. For the turbinates, I will flash the light toward the lateral side. So the turbinate is pink in color, flat and dry. Now proceed to the sinus examination. There are 4 sinuses, out of which frontal and maxillary sinuses are clinically examined. Now a pipette for the frontal sinuses. Do you have any pain?
No.
Now I palpate for the maxillary sinuses. Any pain?
No.
Okay. So the sinuses are clear. Now I Now I will trans-illuminate the frontal and maxillary sinuses. First, the frontal sinuses. मैं कौन सा Now, maxillary sinuses. Open your mouth. Open it completely. Now I will trans-illuminate the maxillary sinuses. Open your mouth. Open it. Okay. So the sinuses are cleared. So the sinuses are cleared. So Aditya, so Aditya, there is no pathology in your ear and nose, and sinuses are also clear.
Okay. Thank you.
Welcome.
Good morning.
Good morning.
So may I know your name
Susila,
and your age?
50.
Okay. Today I am going to examine your mouth. Do you agree with it?
Yes.
Okay, let's start. Inspect your lips. Inspect the lips for symmetry, color, moisture, and note any ulcers, nodules, and cracking. Inspect oral mucosa. Open your mouth. Okay. You can inspect the oral mucosa. Note for any ulcers, nodules, and white patches, and any lumps, and also color of the oral mucosa. Inspect the gum and teeth. Inspect the color of the gums, which is normally pink, and inspect the gums and interdental papilla for any ulceration and swelling, and inspect the teeth for any missing, abnormal deposition and discolor, and let's palpate the teeth for looseness and also gum. Let's inspect the hard palate. So, say up. So, let's inspect the color and architecture of the hard palate. Inspect the tongue and floor of the mouth. Put your tongue out. Okay. So, let's inspect the tongue symmetry, which is the test for hypoglossal now. And let's inspect the color and texture of the dorsum of the tongue. And let's inspect the tongue, like size of the tongue and also undersurface of the tongue. So let's inspect the sides of the tongue and also like undersurface of the tongue. So note for any lesions or nodules and also reddened areas. Let's inspect the pharynx. say note the rise of the soft palate, which is a test for vagus nerve, and also inspect the soft palate, tonsils, uvula, and anterior and posterior pillars and pharynx, and note their color, symmetry, and also their is there any swellings, ulcerations, and tonsillar enlargements. So your oral examination is done, and your oral hygiene is well and good and healthy. Thank you for the cooperation.
Thank you.
Good morning, sir.
Good morning.
So, may I know your name,
Iyyappan,
age?
56.
Okay. And today I am going to examine your lungs. Do you agree with that?
Yes.
So, sir, can you give me your shirt?
Okay.
So, let's take the survey of respiration and also your thorax. And I'm going to observe the rate, rhythm, and depth of the breathing, and also the your effort of breathing. Sir, can you do normal breathing? Okay. Then I'm going to note the respiratory rate. So the respiratory rate is 15 breaths per minute, and let's check the chest for symmetry and initial. So let's see the color of the nails and color of the lips for sinuses. So let's check the neck for the contraction of accessory muscles, and let's check the trachea if the trachea is aligned in midline. So let's start the examination of posterior lungs. Sir, can you turn over? Okay, observe the posterior part of the chest for any deformities, contour, and also the color. And let's palpate the chest, posterior chest to locate any area of pain and tenderness and also bruises. So you have to tell when you feel pain. So do you feel any pain?
No.
Okay. Then we can check for chest expansion. So do you take do normal breathing? Okay. I'm going to palpate your posterior lungs for tactile firmness. Can you say 99 repeatedly?
Yes. 99, 99, 99, 99, 99, 99, 99, 99, 99.
Stop. Let's start our percussion. In percussion, we have to listen the pitch, intensity, and duration of the percussion notes, and note the sense of vibration, and also note the type of notes which you are hearing in percussion. So let's start with percussion. So the normal lung pressure estimate. So let's estimate the diaphragmatic extrusion, which is the descent of diaphragm, and sir, can you hold the breath? So the diaphragmatic extrusion is normally 3 to 5.5 centimeter. So let's do auscultation. So in auscultation, we have to compare the blood sounds in each side of the lungs and listen for the intensity and pitch of inspiratory and expiratory sound, and say whether which type of blood sounds are here, and not for any added or adverse sounds. And the normal blood sounds are vesicular, bronchovesicular, bronchial, and tracheal. And the added adverse blood sounds are, it can be crackles or rays, non-kite and wheezing, and listen to the at least one times of breathing, so that it can be, each and every part can be covered. Here the normal blood sounds are here. So let's do for transmitted blood sounds. Can you turn over? Okay, let's do for bronchophony. Can you say 99?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, stop. And can you turn over? And let's say for echophony. Can you say E? Okay, stop. Okay, let's check for whisper pectoralogy. Can you repeat 1, 2, 3?
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Yeah, okay. Sir, please turn over. So our lung examination is done, and our lung is normal and healthy. So thank you for the cooperation.
Thank you.
Thank you.
Hello, I am Chaudhary Aditya, second year medical student. May I know your name and age, please?
My name is Oropharynx Chaudhary and I am 49 years old.
So today I am here to examine your cardiovascular system. So may I have your consent for it?
Okay, all the very good.
So let's begin. So we will begin the examination from the right side of the patient. For this, I will ask the patient to lie in supine position and 30 degree from the horizon. First, I will inspect and palpate the vessels of the neck. First, I will inspect and palpate the vessels of the neck. So by shining the light obliquely, I will note the highest point of venous pulsation. To measure the jugular venous pressure, firstly we need to find the sternal angle and place the ruler in the vertical direction, and place the second ruler horizontal at the right angle to the first ruler, so that the lower edge of the second ruler lies at the top of level of the venous pulse. Now note the level of the ruler 1. Add 5 cm to it, since the sternal angle is 5 cm away from the right atrium. Now I will palpate the carotid arteries. For this I will palpate the medial end of the sternocleidomastoid above its base. Use the right thumb to palpate the right carotid artery and the right second, third and fourth fingers to palpate the left carotid. Make sure that you should palpate the carotid artery one at a time. Now we will continue with precordial examination. In this, we have to inspect and palpate the pericardium. For that, I will note first the location of the apex beat and note its amplitude, rate and rhythm. Once palpated, mark it with an X. Okay. Now I will palpate for heave, lifts and thrills. For this, I will place my hand against the chest wall at the right second intercostal space, left second intercostal space, doing the sternal angle and at the apex. And for palpating the thrills, I will press the ball of my hand over the chest to check for palpating and thrills. I will press the ball of my hand over the chest to check for buzzing and vibratory sensation caused by underlying turbulent flow. Now I will palpate the S1 and S2. For this I will place my right hand over the apex beat and my left hand over the carotid artery. Since the carotid upstroke follow the S1 and S2 lies just after the carotid upstroke. Now we will auscultate the pericardium. Firstly, we will note the heart rate and its rhythm. After noting the irregularities of the heart rate, we will auscultate the main four positions of the chest. Now we will identify the S1 and S2. For this, I will put my diaphragm at the base or at the apex and my left hand on the carotid artery. Since the carotid upstroke corresponds to S1 and the other sound we listen is S2. Now I will listen to the splitting of the S2. For this, place the diaphragm over the pulmonary wall area and ask the patient to take long deep breaths. And listen for the splitting of the S2 at the end of the inspiration. Now we will listen for S3 and S4. For this, I will position the patient in the lateral decipitus or lean forward position and listen to one of the efforts. Usually we listen to S3 in early or mid systole and S4 just before the S1. Now we will listen to systolic and diastolic murmurs. This completes our cardiovascular examination. Thank you.
Hi, I'm Dr. Subramanian Baranthaman. What's your name and age?
I'm 22 years old.
Okay, I have been assigned to do your abdominal examination for you. Is it okay with you?
Okay.
Okay, first sanitize your hands.
Okay.
Did you feel any pain over your abdominal area?
No.
Did you feel any tenderness over your abdominal area?
No.
Okay, please lie down. Please raise your legs. Okay, relax. I am going to drape your t-shirt until your nipple line. Is it okay with you?
Okay.
Okay. Now I am going to inspect your abdomen for its shape, which is normal. And the abdomen is no asymmetry. The umbilicus is in correct position. There is no ecchymosis or dilated veins. The aortic pulsation is normal. There is no abnormal peristaltic waves. Now I am going to auscultate your abdomen. There is no breathage. The auscultation looks normal. Now I am going to percuss your abdomen. Funny, 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 funny. The percussion notes are good. Now I am going to palpate your abdomen. If you tell me if you feel any pain, can you please take a deep breath from your mouth for a while? First I am going to do a light palpation. Okay, relax. There is no tenderness in your abdomen. Now I am going to do a deep palpation. Can you breathe in your mouth for a while? Okay, relax. There is no any abdominal mass. Now I am going to examine your liver. Can you please flex your leg? Okay. Now I am going to percuss for the liver on the lower side until I hear the lower border of the splenic dullness, which is I hear here on the upper side. I have to percuss it from the nipple line. The dullness check here from here. I am going to measure the length here to here. The liver span is 6.5 cm, which is normal. Now I am going to palpate the liver. For this I am going to place my left hand over the posterior abdomen. By using my right hand, I palpate using the lower part of the liver dullness. Can you please take a deep breath? Okay, relax. Now I am going to do the cooking technique. Can you take a deep breath? Okay, relax. I see the normal liver, which is a sharp and smooth edge. I am going to examine the spleen. Generally, Generally, spleen is not palpable. If you want to palpate the spleen, we need to place our left hand over the lower border of the posterior thorax, and by using the right hand, we need to palpate the spleen. Okay. Can you please move to your right side? Place your left in the flexor position. I am going to focus for the spleen from the 11th intercostal space. Can you please hold your breath? Deep palpate. Okay, back to normal. Okay. There is no splenomegaly. Now I am going to do the test for your assays, which is a fluid wave. Please hold your hand over like this. Okay. Relax. The test is normal. Now I am going to do the shifting dullness. Can you please move to your left side? On the normal position. The test is normal. Now I am going to do the closing sign. Tell me if you feel any pain over here while I am palpating here.
No.
Okay, that test is normal. Now I am going to do the Sway's test. For this, you have to resist my hand by using your right leg. Tell me if you feel any pain over here.
No.
Okay, relax. Test is normal. Now I am going to test for the peritonitis, which is a rebound tenderness. Tell me if you feel any pain.
No.
Okay, the test is normal. Now I am going to do the updated signs for the appendicitis, which is please turn your left side. Please relax your leg. Tell me if you feel any pain over here. Did you feel any pain?
No.
Okay, relax. Come to the normal position. Okay, now I am going to check for the Murphy sign for the scoliosis disease. Can you take a deep breath? Can you escape? Tell me if you feel any pain.
No.
Okay. Can you please sit straight? Now I am going to do the kidney punch. Tell me if you feel any pain.
Okay. No.
Okay. Please sit down. Come to normal position. Your abdominal examination is over. Thank you for your cooperation.
Hello sir, I am Chintha Bhuvaneswari. Sir, I have been asked to examine shoulder, wrist, hand examination and motor examination of upper extremities. Is that okay with you?
Okay.
May I know your name please?
Pawan,
Okay. Your age?
25.
Show your hands. Now I will proceed with the examination. First step is inspection. Inspect the shoulder girdle anteriorly and inspect posteriorly muscles, scapula, and note any swellings in the joint capsule or in the subacromial bursae or under the deltoid tissue. And second step is palpation. First palpate the sternoclavicular joint. Then trace laterally until you reach the acromion. And from posteriorly, Palpate the scapular spine and trace laterally until you reach the abdomen. Acromioclavicular joint palpate and down. You can palpate the coracoid process. Palpate the greater tubercle and palpate the biceps tendon. Now lift the elbow posteriorly and palpate the subacromial bursa and subdeltoid bursa also. Now we will go into the range of motions. First flexion, now extension, abduction, now adduction with the other hand also, adduction. Now internal rotation like this. Now external rotation towards the ceiling also. Now we will go into maneuvers of shoulders. First is crossover test for acromioclavicular joint. With the other hand also. Then second is F-scratch test. Do like this. Then do like this. Are you feeling any pain?
No.
Next is knees impingement sign for rotator cuff muscles. With one hand press on the scapula and with the other hand raise the arm. Are you feeling any pain?
No.
Do with the other hand also. Are you feeling any pain?
No.
Now Hawkins impingement sign. With the other hand also. We can test for supraspinatus. Thumbs down. Press against my hands. Now test for infraspinatus. Thumbs up. Press out against my hands. Test for forearm supination. Turn your arms like holding a ball of soup. I will be pressing against that. And drop arm test. Abduct your arms and slowly adduct. Now we will go into elbow examination. First sanitize your hands. First step is inspection. Inspect the epicondyles and check the olecranon process of the elbow. Note any swellings or deformities. Second step is palpation. Palpate the epicondyle for any tenderness or effusion. Palpate the olecranon process. Now we will go into range of motions in elbow. Flexion, extension, supination, pronation. Now we will go into wrist and hand examination. First inspection. Inspect the palmar surface and dorsal surface also. Note any deformities or deviations. Now palpate the distal radial and ulnar and palpate 8 carpal bones. Now palpate in the anatomical stuff box. Are you feeling any pain?
No.
Now palpate the metacarpal joints. Palpate the proximal interphalangeal joint. Now distal interphalangeal joint. Now squeeze this metacarpal joint. Are you feeling any pain?
No.
Motions, flexion towards the ceiling, Now I will check the ulnar deviation, radial deviation, same, ulnar deviation, radial deviation. Now we will go into manuals. First assessing the carpal tunnel syndrome. Show your hand. First palpate the index finger for median nerve. Palp the fifth finger for ulnar nerve. Palp the web for radial nerve. Same. Are you feeling any pain?
No.
Okay. Now test for hand grasp strength. Hold my hands. Squeeze. Okay. Now thumb movement. Hold like this. Okay. Are you feeling any pain?
No.
Same. Any pain?
No.
Okay. Thumb abduction. Are you feeling any pain?
No.
Same. Any pain?
No.
Okay. We will go into tunnel sign. Are you feeling any pain?
No.
Same. Any pain?
No.
Now we will go into phalanx test. Do like this. Are you feeling any pain?
No.
We will go into range of motions and maneuvers of the thumb and fingers. Make the fist and release. Abduction, adduction. Okay. Thumb flexion, extension, opposition, abduction, adduction. We same with the other hand also. Flexion, extension, opposition, abduction, adduction. Thank you for your cooperation. Now we will go into motor examination of upper extremities. First we will inspect any involuntary movements. And muscle bulk we will inspect. Any atrophy. Now we will go into muscle strength. Shoulder abduction. Against my hands. Adduction. Adjust my hands. Elbow flexion. Resist against my resistance. See. And extension against my resistance. Wrist flexion. See. Wrist flexion. And wrist extension against my resistance. Same. Okay. Flexion at the PIP. Extension. Now hand grasp test. Now abduction. Test for abduction. Against my hands. Same. Test for opposition of thumb. Against my resistance. Same. Thank you.
Sanitize my hand, also your hand. Myself Sharma Prateek, I am going to examine your knee and also the motor examination of lower extremity. I am a second year medicine student. Do I have consent for the same?
Yes.
What is your name?
Keshav Sharma.
And what is your age?
18.
Can you sit down there? So I'm going to examining your legs for the any kind of deformity or any hypertrophy of the muscle or any kind of muscle tenderness, etc. Can you extend your knees? One knee only, this one. Can you extend your knee? Okay, down. For this, extend your knee. Okay, down. Can you lie down supine on the bed?
Yes.
So it's a very simple examination, no need to worried about anything. And if you still you feel any pain or any kind of discomfort, please let me know about this. Okay. So there is no deformity, erythema or swelling around your knee or the lower part of your leg. Everything looks fine. So now I'm going to palpate the hollows around your patella. This look fine. Can you make it extend? This one. Okay. Now I'm going to examine your suprapatellar pouch. Looks fine. I am going to palpate the medial meniscus. It's fine. For this leg, okay. Flex your knees. So now I'm going to check about the medial meniscus. For the left leg, if there is tenderness, then there might be a partial tear of this band. Now I'm going to check about the lateral meniscus. For the other leg. So this looks fine. Now I'm going to check about the condyles of both the knees. So now I'm going to examining about the collateral ligaments of your knees. First I will check about medial collateral ligament. For the other leg. For the lateral ligament. For this one. Now I am going to examine about the tibiofemoral joint around the plateau of tibia. Okay, everything looks fine. Now extend your knees, both the knees. Okay, rock leg. Can you sit on the edge of the bed? Extend your leg. This one. Only one. Down. Up. Down. This one. Up. Down. Up. Down. Can you rotate it inward? Like this. Stay. Can you rotate it outward? Okay. For this, rotate this inward. Okay. Straight. Outward. Okay. Again. Okay. Lay down in the supine lying position. Now I'm going to perform some maneuvers. So the first is McMurray's test. So for this, flex your knee. I'm going to rotate your tibia medially, and now extend your leg like this. So it will palpate your lateral meniscus completely. Okay. So the next one, I'm going to perform the valgus stress test. For this, flex your knee. I'm going to rotate your tibia externally and partial abduction so that it will completely indicate your medial collateral ligament. It is for excessive capping or pain in the knee. So the third one is varus stress test. For this, I'm going to rotate your tibia externally and then so that it can help me to palpate the external collateral ligament. Now I'm going to perform the Legman's test. Can you make it flex 30 degree? Yeah, like this. Make it relax. Now I'm going to perform the drawers test. Can you make it 90-degree flex? I'm gently sit on your toe. So if it's make you uncomfortable, please let me know. Now I'm going to palpate your anterior cruciate ligament. And for the posterior cruciate ligament, I need to jerk towards you. Okay. I'm going to examine the individual muscle movement related to your knee and thigh. So I didn't find any involuntary movement or any kind of deformity in your legs. So first is flexion of your hips. Now try to lift your leg upward, down, okay. Now second one is extension of your hip. So the third is abduction of your hip. Try to abduct your thigh outward. Now I'm going to examine the adduction of your hip. Try to put your leg towards your second leg. Okay. Again. Okay. Again. Okay. So now the last is extension of your knee joint. Try to extend your leg. Okay. Again. So now flexion of your knee. I'm holding your leg from here. Try to flex your knee. Now the last part is about your toes. So for plantar flexion of the toes, face it towards the ceiling. Put my hand behind your toes. Try to complete extend your toes. Okay. Again. Again. And now for dorsiflexion, I put my hand here. Try to flex it towards your body. Okay. Again. Again. Okay. Now it comes to an end. Thank you.
Hello, I am Katthula Nishanth Kumar, second year medical student. I am going to perform cranial now 1 to 7 examination on you. Is that okay with you?
Okay.
May I know your name?
Aditya.
I am going to touch your face while examining. Is that okay with you?
Okay.
If you feel uncomfortable during examining, please let me know. We are going to start with olfactory now. First, checking for patency of each nostril. Do you have cold?
No.
Okay. Can you please close one of nostril? Sniff through other. Now close another nostril. Sniff through other. Relax now. Close your eyes. Close one of nostril. Can you identify the smell?
Yes, it's close.
Now close another nostril. Can you identify the smell?
Close.
Open your eyes. Test for optic now. First, visual acuity test. Make sure the patient to stand 20 feet away from the Snellen's chart. Can you please close your left eye with left hand? Read the letters.
E, F, P, T, O, Z, L, P, E, D.
Okay. Now close the right eye with right hand. Read the letters.
E, F, P, T, O, Z, L, P, E, D, F, E. I can't.
Okay. We are going to do static finger wiggle test. Let's start. First, close your left eye with left hand. Say yes when you see any movement.
Okay. Okay. Yes.
Now, close the right eye with right hand. Say yes when you see any movement. Relax. Now, see into my eyes. Say yes when you see any movement. Ophthalmoscopic examination, you may feel little bit uncomfortable. Test for oculomotor now. First, direct light reflex. Next, convergence test. I want you to focus on this pen.
Okay.
Extraocular muscles which are controlled by cranial nerves 3, 4, 6. Follow the pen. For trigeminal now. First, motor examination. Clench your teeth. Palpate the temporal muscle. Next, palpate the masseter muscle. Can you please move your jaw side by side? Okay. This is the examination. Now I am going to do touch test. This is the sharp end. This is the blunt end. Tell me when you feel whether it is blunt end or sharp end when I touch on your face. Close your eyes.
Blunt. Blunt. Blunt.
Open your eyes. Okay. Now I am going to do corneal reflex test. Open your eyes. See that side. Now I am going to touch your cornea with cotton. Okay. Facial now examination. First, taste sensation test. Expose your tongue. Now I am going to add 2 to 3 drops of solution on your tongue. Open your tongue until you identify the taste. What you felt?
Sweet.
Evaluating the symmetry of face at rest. Raise your eyebrows. Frown. Close your eyes tightly. Don't let me open. Show your lower and upper teeth. Smile. Puff out both cheeks. Thank you for your cooperation.
My name is Nagar Shruti Kumari. I am second year medical student. Today I am going to check the vestibulocochlear nerve. Whisper voice test.
U1.
Okay. which ear?
Both ear.
Okay. And I am going to perform Britney test. In which ear you hear the sound?
Yes, both ear.
Okay. Examination for 9th and 10th cranial nerve. I ask to patient to ah. I inspect the tongue. I inspect the soft palate and pharynx. Okay. Uvula remains in midline. Open your mouth. Protrude tongue. Okay. I am using the tongue depressor and place the back side of the. Yeah. In healthy people, diminished gag reflex. Okay. We ask to patient to turn his head against resistance. This test for sternocleidomastoid muscle. Test for trapezius muscle. Shrug your shoulder. Okay. This test for cranial nerve 12. Open your mouth. Okay. I am checking your tongue. I look for any fasciculation and asymmetry. There is no fasciculation. Move your tongue side by side. Okay, that's fine. There is normal. Okay. Reflexes. Biceps reflex. We place the finger and thumb. We feel the contraction of biceps tendon and flexion of forearm. Triceps reflex. We tape the olecranon of the elbow and feel the extension of the elbow. Brachioradialis reflex. We tape on the styloid process of radius and we feel the flexion of the elbow. Knee reflex. We tape on the patellar tendon and there is the extension of the leg at the knee joint. Okay. Ankle reflex. We tape on the Achilles tendon and plantar flexion of the foot. Babinski sign. We strike the blunt to the object from heels to toes. There is dorsal flexion of the big toe. Clonus reflex. We are going to do plantar and dorsal reflex. You feel any stimulus?
No.
Okay. There is fine. You are normal.
I am Subrata and I am your doctor today. Please state your name and age.
My name is Sharma and I am 20 years old.
Okay, so I am going to examine your cerebellum functions and sensory system. For that, I will need to perform some tests. Is that okay with you?
Yeah, it's okay.
So, before that, we will sanitize our hand. So, let's begin with cerebellum functions test. The first is finger, nose, finger test. I am going to place my finger here and you have to touch your nose and touch my finger. And I will slowly move my finger like this and you have to repeat the same. Alright, so the next test is rapid alternating movement. In this test you have to pat your knees like this and this and I'll check for it. Do it as fast as you can. Okay, so the next test is heel to shin test. In this test you have to slide down your heel like this from the tibial surface from the other leg. So please proceed. Other leg. Again. Okay. So the next test is gait test. In this test I am going to ask you to walk back and forth several times and I'll observe your posture and balance and swinging of the arms and I'm going to stand by your side while doing so. So let's proceed. Good. Next test is going to be tandem walking. In this, I'll ask you to walk in a tandem fashion and I'll see if you can maintain a straight line. So let's proceed. Okay, nice. Okay, alright. So now I want you to walk on your toes, and in this process I'm going to be examining your gait as well. So walk on your toes. Alright. So in the same way, now I want you to walk on your heels and I'm going to be examining your gait. Okay, good. So the next is hop on one leg in the gait process examination as well. So you have to hop on one leg and then the other. Okay, next leg. Okay. Next test is shallow knee bend. I want you to bend like this. Other leg. Okay, good. Test is rhombus test procedure. In this test, I'm going to ask you to stand like this and keep your hands on the side and close your eyes. And I'll test if you are swinging or anything like that. Okay, close your eyes. Okay, so now we proceed to sensory examination, and we are going to start with testing your ability to perceive the sensation. So in this series of tests, I'm going to ask you to close your eyes several times, and then you can nod or do whatever I ask you to do after you feel the sensation. So in this, I'm using the symmetric pattern on both sides of the body because comparison helps better identify the distribution of any sensory abnormalities. So now we'll proceed with pain sensation test in your arms, legs, trunk by using this tool. So please close your eyes and let me nod when you feel the sensation. Keep your hands on your knees.
Yes. 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 Yes.
I'm gonna use your leg.
Yes. Yes. Yes.
Alright. So now we proceed to temperature testing. In this, I have one hot test tube and one cold test tube. And now you close your eyes and tell me which one it is.
Cold. Hot. Cold. Hot. Cold. Hot.
Alright. So now we proceed to light touch test. In this, I'm going to assess the light touch with this cotton wisp. So close your eyes and whenever you feel it, say so.
Yes. 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 Yes.
Okay. So now I'm going to assess vibratory sensation using a lightly vibrating low-pitched tuning fork and placing it over the bony prominences and the distal tissue of your finger. So you tell me what do you feel when I do this. So you have to close your eyes first.
Yes.
Tell me when it stops.
Stop.
I'll do this in another hand.
Yes, stop.
Close your eyes.
It stopped. It stopped.
Okay. So the next test is position sense or proprioception. In this test, I'm going to hold the side of your big toe and then ask you to close your eyes and identify the direction of the motion of the toe I'm moving it in. So can I please see what I have?
Upward. Downward. Side. Right side. Upward.
Okay. Can I have your another leg?
Upward. Right side. Left side. Downward.
Okay. So now I'm going to test position sense in the upper extremities, beginning with the finger of each of your hands and moving them. So please tell me the directions. Please close your eyes.
Upward, downward, upward, downward, upward, downward, upward, downward.
Alright. So now I'm going to test discriminative sensations in both the hands, beginning with stereognosis, which is the ability to identify an object when you feel it, by feeling it. So please close your eyes and I'm going to place some object in your hand and identify it.
It's a coin.
Okay. I'm going to place another object in your another hand. Please identify it.
It's a cellotape.
Alright. Okay, so now we proceed to test graphesthesia, that is number identification. So I'm going to ask you to close your eyes and then I'll draw a number on your palm and please try to identify it. So close your eyes.
It's number 8.
Alright. We go ahead with the 2-point discrimination, in which I'm going to use two ends of this pin and repeatedly touch your finger pad with 2 points at the same time, or occasionally I'll use 1 point and then reduce the distance between the 2 points as you move forward with the examination. So please identify if you feel 1 or 2 points. So close your eyes and please can I have your
1 point, 2 point,
can I have another end?
2 point, 1 point.
Alright, proceed with point localization test, which is helpful for locating sensory loss in the trunks or legs or like that. So I'm going to ask you to close your eyes again and let me know the point touched. So please close your eyes. Here comes the first touch.
Here. Here. Here.
Alright, so the next test we're going to perform is double extension test. So I'm going to provide a stimulus in 1 or 2 areas simultaneously and you tell me whether the stimulus was on one side or the both side. Okay, so close your eyes.
One side. Both the sides. One side.
Alright, so your sensory and cerebral functions are normal. Thank you.